It's a common question. What's the difference between minimally invasive surgery and open heart surgery? Is one without opening the heart? Is the other one with opening the heart? Essentially, the difference between the different types of cardiac surgery you hear about in terms of robotic, minimal invasive, and open is just the access. The operation itself is the same, or in my opinion, should be the same, no matter how you access the heart. So for example, if you need coronary artery bypass grafting or CABG, which is the commonest operation that we do on the heart, then there are three ways you can approach it. One is the traditional open incision down the middle of the chest. The other is the minimally invasive option, where you have a small incision on the left side of your chest. And the third is the robotic-assisted version of the minimally invasive operation. So what's the difference? The open operation is the standard operation. It's been performed for decades, extremely safe operation. You have access to all areas of the heart, and you can do any operation through this access. However, there is a downside, which is when you have a big, long incision in the chest, people feel that it's unsightly. There's a lot of discomfort after surgery, and so people tend to not like that surgery. With the minimally invasive surgery, the advantage is that it's a smaller incision, the discomfort is less, the ability to recover is faster, pain and trauma is less, and bleeding is less. So in a sense, if you can do the same operation through a small incision as opposed to the big incision, then by definition, that should be better for the patient. So we go along that same trajectory, we get to robotic surgery. In robotic surgery or robotic-assisted minimally invasive surgery, the pushing and pulling that usually occurs between the ribs when you're doing the same operation with a small incision is greatly reduced, because the camera is able to look up, look under, and you don't need to pull the ribs up and down. So the trauma is even lesser, and the patient is able to recover even faster from a robotic-assisted cardiac surgery. So between the big incision to robotic, what changes is not the operation. The operation remains exactly the same. What changes is the patient's experience of the operation. There's more pain with open surgery, less pain with minimal invasive, and even lesser pain with robotic. There is more blood loss with open surgery. There's least amount of blood loss with robotic surgery. There is longer duration of convalescence or recovery with open surgery. There is much less time with recovery when it comes to minimally invasive or robotic surgery. But the question is, what are you a candidate for? Though all surgeries can be performed with minimally invasive techniques, not all patients are candidates for these techniques. So the best way you can assess is to actually go to a surgeon who's able to perform both, so they can actually look at you and decide, based on your tests, based on your body habitus, based on the disease that needs to be taken care of, whether you would be an appropriate candidate for a robotic or minimally invasive surgery. Thank you.